So the first case study that we'll take a look at is Brad. So we came across Brad following an inquiry from a clinician who had recently got ACT into their clinic. So they emailed in to us asking a few questions about how to utilize the ACT score that they measured for Brad, due to the fact that he had slightly older hearing aid technology, which didn't have the ability to automatically use the data we gathered.
So that's a really commonly asked question. But before we jump in and find the answer to that, let's just learn a little bit about Brad first. Can you give some insights into Brad?
Yeah, absolutely. So Brad is a 71-year-old gentleman. He is very, very active. He likes to go out with friends, family quite a lot. And he's very involved in the community as well. He does lots of volunteering work. And as a result of such an active lifestyle, he's often finding himself in a lot of these much more challenging listening situations. Things such as cafes, restaurants, all of those environments where there's multiple speakers, lots of things going on around you, which makes things difficult for hearing aid users on the best of days. So Brad was fitted approximately a year ago with a pair of bilateral hearing aids. And since that time, he has found that he's been getting on reasonably well with the hearing aids, but they weren't quite meeting his full expectations. And he was still having a fair amount of difficulty in those more challenging listening environments.
Okay, that's still quite a common theme we see with hearing aid patients, right? People have been fitted with their hearing aids, but there's still some challenges in those complex, noisy situations. What about his audiogram and his general medical history? Did anything change there which could explain why those challenges were happening?
So when Brad came back for his year review, nothing had changed in terms of his audiogram. So he presented with a bilateral, symmetrical, high frequency, mild to moderate sensory neural hearing loss. So quite consistent just with presbyocusis. This has been a gradual change for him over many years, no sudden changes. And his medical history, again, was completely unchanged from the last time that he was seen. The thing that had changed, however, was that since he had been seen previously, the clinician had got a new audiometer with ACT on it. So in light of the continued difficulties that Brad was having, they made the decision to go ahead and test his ACT scores.
Okay, so what was the big reveal? What was Brad's ACT score?
So Brad's ACT score was actually very high. So he measured a score of 10.4, which puts him into the severe range for the ACT test.
And what does that mean in terms of his hearing aids and adjusting those?
The ACT scores can be divided into four main categories of either normal, mild, moderate, or severe. And depending on where on that scale you're sitting will inform how much help you're going to need in those difficult listening situations. So for Brad being in that severe range, what that tells us ultimately is that he's going to need arguably more help in those difficult situations from his hearing aid or potentially through other technology assistive listening devices.
And so you mentioned there more help. What does that actually mean in the real world? How do you give him more help?
It's a difficult one to answer generically speaking, purely because every single hearing aid is going to be a little bit different. There are certainly some common features that we see. So things like noise reduction programs, directional microphones, all of these kinds of features are those which are going to need to be adjusted based upon his severe ACT score. So we mentioned that in his particular case, there's no automatic implementation. So it comes down to you as a clinician to know your hearing aid and know what it can do and know what features you can adjust or turn on or turn off to try and maximize his ability in those difficult situations.
Okay, so let's deep dive into Brad himself and his hearing aids. What did you recommend to the audiologist to do?
So in Brad's particular case, his hearing aids have a few different features that can be adjusted to help in these more difficult listening situations. Broadly speaking, his hearing aids can be tuned to be either kind of quite balanced, it's described as, or exact or gentle. And the differences between these are largely how some of those advanced hearing aid features are tuned and sort of implemented. So an exact profile is going to give much more harsh and strong noise reduction compared to a gentle profile, which is more designed to keep sound as natural as possible. And of course, there's a trade-off between the two, because there can be the question of, well, if giving them exact is going to reduce noise more, why don't we give that to everyone? Because everyone wants less background noise. But there is a trade-off in terms of the sort of perception of sound as well for that individual. So we only really want to use that setting when we actually need to. And that's what we gained from performing ACT, is that we identified that need, and then we know that making that trade-off of the quality of the sound for better speech and noise performance is worthwhile taking.
So Brad was pushed all the way to exact.
He was, yes, and that adjusts quite a lot of features within the hearing aid. Not only noise reduction, but also things like directionality of microphones. And all of these changes made did for him yield a good result. He does still have some difficulties, but he did report that overall they are significantly improved from where they were at the time that he was most recently assessed.
So that's a really nice ending for Brad. It's great that the ACT test and the implementation into the hearing aids was able to really improve things for him. Let's just take a hypothetical situation as we're here and imagine Brad had a normal ACT score or an ACT score which was just in the mild range. What would you be thinking about in that instance for adjusting this particular instrument?
Sure. Well, in those situations, that's really great for the patient and for us as clinicians, because really that's going to be the best case scenario for this individual with their hearing loss. We know from that they are going to be able to quite successfully manage in those more tricky listening situations. So then our priorities as a clinician, when we're thinking about what adjustments we're making, can shift a little bit, and we can start focusing more upon trying to make the sound that the individual is receiving as pleasant as possible. So we're less focused on trying to pick out specifics, and more we can give a more holistic, rounded representation of sound. So in Brad's particular case, that would kind of lead us in the opposite direction. Instead of having him on an exact profile, we would lead him more to the gentle side of things, which is going to reduce down some of those harsher signal processing elements, which can sometimes alter the overall comfort of the sound that patient's receiving.